We've made a great deal of progress in the last 15 years with the treatment of venous disease and varicose vein disease. As a surgeon, the only thing we had 15 years ago was the old stripping procedure. Most patients did not like the stripping procedure because they'd have to have their procedure done in a hospital. They'd often require people to drive them there and back. And often your leg would be wrapped and you'd be laid up on the couch for 2 weeks after that. None of us have that time to give anymore. And back in 2002, the FDA approved laser ablation of varicose vein disease and the great saphenous vein in your leg that's often the cause of varicose veins. And since that time, endovenous ablation with either laser or radiofrequency have become the gold standard, primarily because the treatments can be done in the office. They do not require any sort of downtime. You could go back to work the same day that you've had your treatment. The other big problem with stripping, besides the pain, was the higher rate of recurrence. Stripping used to induce something called neovascularization, which is a creation of new veins. And unfortunately, these new veins, which were created, did not work very well. So patients would come back to see me 2 years after their stripping, and their problem would be back and it would be worse.